March is Endometriosis Awareness Month, and I am going to do a two-part series about endometriosis so that you can learn everything you need to know about it. So, we're going to talk about what endometriosis is, the symptoms of endometriosis, causes, and then we're going to shift the next time we talk, the next part of the episode. We're going to talk about current technology and treatment from a Western standpoint and how it's really treated from an integrative standpoint. We're also going to talk about other little known facts about endometriosis that a lot of women aren't aware of, and also some clinical pearls that I've found from treating it in my practice. I'm Caroline Ashurst. Welcome to the Fertility Formula. I'm so happy you're here. My goal is to give you help and the roadmap to help heal your fertility and get the support that you need. So we're going to go ahead and jump in. If you want to book a call with me, a consult, I do free consults. I'd love to talk to you about what's going on and help you get the roadmap to heal your fertility and your egg quality. So below are some links for that. Here to help. And let's jump in. So the good news is that an endometriosis diagnosis is not the end of your fertility. It doesn't mean you can't get pregnant. It might be a little bit more of a curvy, twisty path to get there, but with the right providers and the right practitioners and treatments, you can navigate this with empowerment and hope. So, what is endometriosis? A lot of my ladies know what this is, and a lot of people struggle with endometriosis. So, with endometriosis, what happens is that the tissue that's usually found in your endometrium, endometrial lining, your uterus, is found in other places in your body outside of your uterus. So it's really only supposed to be in there. It's a specific kind of tissue that behaves a specific kind of way. It's responsive to hormones. It's responsive to many different things that are happening in the body. And that tissue is usually made out of fibrin. So the thing about endometriosis is that it does not only live in the uterus, it can attach itself outside of it. And that's essentially a lot of what we're looking at is like the lesions of the tissue inside the uterus, but also outside of it. We're going to talk a little bit more about that. So it causes systemic inflammation in the body, and inflammation exacerbates it. So it's got this like cycle of repeating itself. Having it in and of itself causes inflammation, and then inflammation makes it worse. So just like our uterus again, it responds to hormonal changes and behaves like endometrial tissue, but in other parts of the body. So some of these symptoms are what you would experience if you have painful periods. You might get pain during your cycle, before your cycle, and other places in your body. And this is actually one of the common symptoms we're going to talk about in a minute. Estrogen is required for endometriosis to grow. So that's another part of this. You will oftentimes find high levels of estrogen in women who have endometriosis. And it is an autoimmune disease. So it's categorized as that because your body creates autoimmune antibodies when you have endometriosis, which then attack your own body cells. So these antibodies circulate through your blood, and those are the attacking cells. So there are different stages of endometriosis. So depending on how invasive and how severe your endometriosis is, you will be in a certain stage. So stage 1 is a very minimal instance of endometriosis. So there are a few superficial implants, the fibrin deposits in your uterus, and superficial meaning that they're in one of the top layers of the endometrial lining. Stage 2 is mild, and there are more of the implants and they are deeper in the tissue layers. Stage 3 is moderate. There's many of the deep implants, and there can be small chocolate, they're called chocolate cysts on the ovaries, one or both. And then there's presence of filmy adhesions. So these adhesions are the sticky tissue that actually like glues your tissues together inside your body. So oftentimes there will be, you know, sometimes we will find that there is uh, the ovary is sticking to another part of the body, or that, you know, tissue is sticking together. It's almost like this glue-like tissue. Stage 4 is severe. There are many deep implants, large cysts on one or both ovaries, and many dense adhesions, like those filmy adhesions that we were talking about. So there are also different categories. So there is peritoneal endometriosis, and that is when it's the most minimal form. And the peritoneum is the membrane that lines the abdomen that is infiltrated with endometriosis tissue. So that's when it starts to grow outside of the endometriosis, um, endometrioma, sorry. Uh, so category 2 is the ovarian aspect, the chocolate cyst that you'll find on the ovary. But one of the reasons why they're particularly risky is because there's a risk of breaking and spreading the endometriosis within the pelvic cavity if there is chocolate cyst activity happening. Category 3 is deep infiltrating endometriosis, and that is the first form of deep infiltrating endometriosis that involves the organs and the pelvic cavity. So that could be the ovaries, the rectum, uterus, and this could significantly affect and impact the anatomy of the organs because it distorts them. So, you know, sometimes you'll have fallopian tubes that are stretched out, or ovaries that are pulled in different directions, or even your uterus will be tilted. Those kinds of things can happen when we have deep and infiltrating endometriosis. The next one is the second version of deep infiltrating endometriosis. There's 1 and 2. So this is 2, and this is a more extreme type that involves organs both within and outside the pelvic cavity. So that could be bowels, appendix, heart, and lungs, among others. There are women that have endometriosis growing on their shoulders and in their back. Um, so we'll transition now to symptoms because that's like an obvious next step in this descriptive process that we're going through right now. So the symptoms of endometriosis, they're different for every woman. And something I want to say that's really important is that, you know, if you look at a symptom list, you do not need to have even more than 1 or 2 symptoms to have endometriosis. That does not mean that if you have painful periods, you have endometriosis. But it means that you, like, oftentimes people be like, well, I don't have all of these symptoms, or I don't have many of them. That doesn't matter. And that does not mean that you do not have endometriosis. So, symptoms that are documented, symptoms that I've seen clinically are painful periods. And a lot of times we're talking about like 5 out of 10. Um, it you know, could even be minimal, but you know, it can really range to 10 out of 10 and worse. Nausea can happen sometimes when you have severe pain. Uh, Long periods, periods that last for a long time, heavy periods, periods have a lot of clots, specifically dark colored clots, dark period blood. So in Chinese medicine, we say that that is blood stagnation. And the symptoms for blood stagnation in Chinese medicine are the same symptoms for endometriosis. Um, and then pain, you know, pain in other parts of your body around your cycle. Again, our hormones change the way our tissue behaves in our body, many different types of tissue. Our hormones impact our body's functions, and our hormones also impact our tissue in our abdomen, right? Because we get pain during our cycle sometimes. So you will have the same kind of pain in the other places in your body around your cycle. So that's something to pay attention to. Um, Another thing that's really important and actually very disappointing is that Well, there's a few different things. Um, Number one is that women are categorically gaslit about their symptoms by our standard intakes. Um, you know, Female doctors have an embodied somatic physical experience of having cycles, and male, usually don't. So uh, it's hard for them to understand the experience of women. And I found that doctors believe that periods that are painful are normal, and they're not normal. We should not have painful periods. If you have a painful period, it means there's something going on that you need to look at. Um, so if you have been complaining of painful periods and your doctor writes it off as normal, please don't stop your questioning there. That leads me to my next disappointing part of what I wanted to share with you is that um, what's true is that people who have this condition wait between 8 and 12 years on average for a diagnosis. Like, let that sink in. 8 to 12 years to get a diagnosis. So if you're trying to get pregnant, first of all, you wanted to get pregnant yesterday. Second of all, you don't have that time to wait. So you really have to advocate for yourself and make sure you're talking to providers that take you seriously, that listen. And we're going to go into, next time we talk, we're going to go into diagnostic tools for this because it's a whole other conversation. But here's what I want to say. I want to add that there is, uh, there's discrepancies in how people are treated and listened to by doctors. And what's true is that for Black women, this picture of waiting 8 to 12 years to get a diagnosis is even worse. Uh, Research shows that 50% Black women are 50% less likely to be diagnosed with endometriosis than their white counterparts. So this is something we really need to pay attention to. And if you're a Black woman, you really have to, unfortunately, advocate for yourself more. And I really acknowledge that you are having to do that in every way, shape, and form in your life in order to get the care and attention that you deserve. So I think what we're going to do is we're going to stop there and we're going to pick up tomorrow more about, we're going to talk about causes, we're going to talk about treatment, and uh, any other anecdotal things. Another thing I wanted to say to you before we go, one of the most important things for me to tell you is symptomologically, to tie a bow on the symptom conversation, is that there is something called silent endometriosis. Have you heard of it? Silent endometriosis is when you have zero symptoms of endometriosis. We're going to talk about causes next time we talk. So there's a few things I want to talk about with that. But there is silent endometriosis where maybe the only symptom you have is that you're not getting pregnant. I had a client who was very healthy. She was a nutritionist. She was a functional nutritionist. So she really ate healthy. And she struggled getting pregnant. And she didn't want to do IVF because it was against her beliefs. And throughout her process of diagnosing what was actually happening with her, they found out that she had silent endometriosis. She had no symptoms other than not getting pregnant. And what I believe is happening is that, you can have this silent endometriosis if you're living a really like healthy lifestyle. You've been for a while and you might have had a minimal incidence of it, right? You might have been in category 1, you might have been stage 1. And depending on how our lifestyle is and things that we're exposed to, right, that can trigger it to become more severe or to just downgrade. We'll talk about that more in the next episode about this. But she would have never known that. She would have never thought that. She would have never investigated that. But I believe that her lifestyle, her very, very, very low inflammation lifestyle, prevented that from showing symptomological signs. And I believe that she didn't have a very severe case of it. Obviously, she would have known, but it's almost like, it's like if you feed the endometriosis with the things that trigger it and create more inflammation, it's going to get louder. So, I really want to share that with you because it's important. I don't want you to get like caught up in your head like that's what might be happening. But if you've been on this journey for years and years and years, and you still don't know what's going on, it might be something to consider. Okay, thank you so much for listening to my podcast. I'm so grateful you're here. Please get in touch with me if you have questions, book a call. There's a link below. There's also my freebie below on how to get and stay pregnant and balance your hormones. I would love for you to grab that. And thank you so much. And we'll talk more soon.